Do you want to know more about wide local excision, which is the commonest surgical procedure for the treatment of breast cancer? This video within the Breast Care YouTube channel explains all about this procedure. I am Mr. Harun Thomas, consultant Oncoplastic Breast Surgeon working in Essex in the United Kingdom.
My name is Mohammad Fallaha and I'm a surgical trainee based at Southend University Hospital in Essex, United Kingdom. A wide local excision is a surgical procedure used to remove a tumour from the breast. It involves the removal of the tumour itself, as well as an area of surrounding healthy breast tissue. The margin is removed to ensure and maximise the chances of removing all of the cancerous cells of the breast and to minimise the chances of leaving cancerous cells behind. That's why we take that healthy rim. The rest of the breast is left intact, as opposed to a mastectomy where all of the breast is taken out. The procedure is usually performed under general anaesthetic and as a day case, which means you can usually go home on the same day that you've come in. There are lots of different types of breast cancer operations, but a wide local excision is one of the most common. It is usually performed when cancerous or precancerous cells are detected on ultrasound or other forms of imaging. You will usually have had a biopsy, so that's a group of cells taken and looked under a microscope, performed beforehand to confirm the diagnosis. Once the diagnosis is confirmed and we know the cell types, the type of operation is usually recommended to you. A wide local excision serves two purposes. Number one, it's therapeutic, so it's used to treat the breast cancer itself by removing the tumorous tissues from the body. The second thing is that a wide local excision involves removal of this tissue and sending this tissue to a laboratory where it can be looked at under a microscope. This means that we can get further information about the particular cell type that's involved, as well as how aggressive the tumour is and other key characteristics which are important for us so we can treat your disease. A wide local excision may also be performed alongside an operation on your armpit, an area where the lymphatic tissue from your breast drains into. Please see our separate video on axillary operations for further information about this.
Prior to your operation, your surgeon will see you in clinic and explain the treatment options, including risks and benefits. Some patients with medical issues may have to see a nurse or a consultant in a pre-assessment clinic. Here, they will take detailed history and give you specific instructions on which medicines to carry on and to stop. You will also be given indications about fasting and other preoperative instructions that you may have to follow. On the day of the operation, you will have to arrive fasted to the ward. A nurse will take your observations and do some paperwork with you. The surgeon will come and meet you, talk to you, and get you to sign a consent form. He will put a mark on the side of your operation. The anesthetist, who is the doctor who puts you to sleep safely, will also come and speak to you, and you can address any concerns regarding the anesthetic aspects with the anesthetist. You may have to take a pregnancy test on the day of surgery. Some patients with a very small and difficult to feel tumors may need to have a small metal thread inserted into the breast on the day of the operation. This is done usually by the radiologist at the time of doing an ultrasound scan. This will help the surgeon find the correct area to remove in the breast. When theatres are ready, you will be taken down to the anesthetic room where the anesthetist will put a small plastic tube into your vein and give you some medicines to put you to sleep. The anesthetist will then put a tube down your airway to help you breathe when you are asleep. You will be then taken into the theatre where the surgeon will clean the area of the operation. This will leave a stain on the skin. The surgeon will then make a cut either over the tumour or around the nipple and will lift the skin away from the tumor. The surgeon will remove the tumor with some healthy tissue all around. After this, the wound will be stitched together and you will have either a glue or a dressing placed over the wound. You may have a cut in the armpit to take some lymph nodes out to check if any cancer cells have gone into the lymph nodes. Please see our other video on sentinel lymph node biopsy, which describes this in more detail. After the operation, you will be taken to the recovery ward where trained nurses will make sure you safely wake up from the anesthetic. Once you are completely awake, you will be taken to the general ward where you will be given instructions on how to look after yourself in the post-operative period. Wide local excision is generally a safe operation with low risks and is very commonly done. But like any operation, there are risks which you need to be aware of before you proceed with the operation. The risks specific to wide local excision are: 1. Infection. Any wound can get infected, and if the area goes very red and painful, you need to contact the surgeon or the team to have it assessed. Another potential complication is bleeding. If there is excessive blood collecting in the area of the operation, it can swell up and get discolored. Sometimes you may have to go back to theatre to have the wound reopened and any blood taken out and sutured back again. The chance of this happening is about 1 in 100. You will have permanent scars in the breast and often in the armpit. This can leave you slightly different on both sides after the operation. If there is a likelihood of significant cosmetic problems, the surgeon will discuss this with you, including any alternative options available. Please discuss placement of the scar with the surgeon before the operation. Another potential problem after wide local excision is what's called positive margin. When a cancer is taken out, we would like to see the cancer with a healthy rim of normal tissue all around. Sometimes, when it's looked under the microscope, the pathologist might find that the cancer cells have gone very close or up to one of the margins of the specimen. If that happens, after a few weeks, you may have to have another operation to go in and take more tissue from around the area. The chance of this happening is between 1 in 10 to 1 in 5. Many women complain of long-term discomfort and numbness in the area of the operation. This is usually not very severe, but can be variable and can last a very long time. Swelling of the breast, also called lymphedema, sometimes happen long-term after the operation. This is because lymphatic fluid doesn't drain out of the breast as in a normal breast without an operation. If the scar is next to the nipple, it can cause sometimes change in shape of the nipple, indrawing of the nipple, and rarely change in sensations of the nipple. Every operation under general anesthetic puts you at a higher risk of general anesthetic complication, including chest infection, clots in the legs and lungs. There is also the risk of catching COVID infection during your interaction with many people during this episode. Apart from this, some patients are allergic to dressings or medications, which can cause some effects during or after surgery.
A wide local excision is normally performed as a day-stay procedure, which means that you go home, as we mentioned, on the same day. You'll be taken to recovery after the operation, and you're usually able to go home a few hours after you've had the operation done. Most of the time, dissolvable sutures are used alongside skin glue, so there won't be any stitches that need to come out. There will often be dressings over the wounds, and you can shower the next day after your operation. The dressing can come off usually after about 3 days. It is not usually painful after the operation, but you might feel some discomfort. We recommend taking paracetamol and ibuprofen to help with this discomfort. You can do light activities such as walking the day after your operation, but we would discourage against heavy lifting and other forms of heavy activities. We would also recommend that you avoid driving 2 weeks after your operation until you can make an emergency stop. The specimen will be sent off to a laboratory and your results will come back in a few weeks where an appointment will be made for you. There, you will discuss the final diagnosis and further treatment going forward. There are other forms of treatment that you may need in conjunction with the operation itself. Some patients who have had a wide local excision will need radiotherapy, which uses a certain form of X-rays to treat the area after the operation. Other patients may be prescribed anti-hormonal treatments that block estrogen if the tumour is of a particular type. The need for radiotherapy and chemotherapy, respectively, will be discussed with you by your doctor. In some cases, it may be preferable to have these procedures done before your operation to help shrink the tumour. Your doctor will further advise you on this matter. As of 2022, an operation is still required to treat the breast cancer, but ongoing research is being performed to see whether some patients may not even need an operation altogether. There are, of course, alternatives to having a wide local procedure performed. The first alternative is that of a mastectomy. This is where the entire breast tissue is removed. If a wide local excision is feasible, having a mastectomy does not improve outcomes long-term after the operation. However, for some kinds of cancer, a mastectomy may be recommended. After a mastectomy, you may need radiotherapy following your procedure. For a wide local excision, the chances of needing radiotherapy are higher following the procedure. The chance of needing chemotherapy, however, is not influenced by whether or not you've had a mastectomy or a wide local excision. A second form of alternative treatment may be tablets to block estrogen. If your cancer has estrogen receptors, it may be possible to block these estrogen receptors in order to treat and shrink the tumour. Of course, it's always possible to have no treatment at all for breast cancer. However, if no treatment is given, breast cancer tends to grow and may end up spreading to other bits of the body and may eventually result in death. To conclude, a wide local excision is a safe and effective way of treating many forms of breast cancer. In conjunction with other treatments, a wide local excision can result in very good outcomes for most breast cancer patients. Thank you for watching our video. I hope that you found it useful.
Thank you for watching.
Please feel free to like, comment and subscribe to this channel.
And watch the other videos in this series.
And to share it with people that you might think might benefit from this information.